Hello everyone. I hope everything is going well with you. Today we will take three of the vital topics, mental illness, medical ethics, and research. And we will take some of the medical abbreviations. The first topic is mental illness. What is the meaning of psychosis? As we have taken that the suffix osis means condition. So, psychosis is a condition that affects the way the brain processes information. It can be classified as organic and functional. Organic disorders are caused by structural defects or physiologic dysfunction of the brain. So organic disorders, the reason behind the organic disorders are known, which is problem in the brain, structural problems or physiologic dysfunction of the brain. On the other hand, the functional disorders have not been yet identified. Psychosis is characterized as affective and non-affective in character. So, what is the meaning of psychiatry? Psychiatry is a branch of medicine that deals with mental, emotional, or behavioral disorders. As we said here, we have two classifications, two categories, organic and functional. Organic, caused by physical illness or an injury that affects the brain, like, for example, brain tumor or infections. What about the functional? Psychological cause and does not involve brain damage. So the reason behind the functional disorders are psychological causes and does not involve brain damage. Like what? Like heredity, stress, can be tied to a disturbing event, abuse, trauma, and so on. All right, for the first type, which is organic, that we said the main cause is physical illness of the brain or injury in the brain. We have here other causes like infections, brain injury, cardiovascular disorders, degenerative disorder, dementia, and alcohol and drug. So all of these reasons, they are known that they cause the organic disorders. From these causes, we have dementia. What is dementia? Dementia is an umbrella term describing a set of symptoms causing a person to have changes in brain function that interfere with the ability to function and to do everyday activities. Dementia, like from 50 to 75% of dementia, is shown in Alzheimer. All right. So psychiatric disorders can be divided into organic and functional. This is what we have said. Dementia is a mental disorder due to organic brain disease. The commonest form of dementia is is that associated with old age, senile dementia. Disorders in which there is no obvious pathology or anatomical change in an organ are termed as functional. So the disorders where the reason or the cause of this disorder is not obvious or is not shown or is not detected are called functional disorders. These are described below. We have substance abuse. Abuse of substance means using it in a way that is harmful. The commonest form of substance abuse are alcoholism and drug abuse. Affective disorders. This extract is taken from a medical textbook. Affect and mood are similar in meaning and refer to the emotions, for example, happiness or sadness. Affect tend to be used for temporary emotion and is expressed through manner of speaking, facial expression, or behavior. So affect is temporary emotion, all right, for short time. Mood is used to refer to a more permanent. Permanent means last for a long time, continuous, all right? Mood is used to refer to a more permanent emotional state. So in Arabic, temporary means مؤقت and permanent means دائم. This is the difference between affect and mood. The most common form of affective disorder is depression. The symptoms of which are poor appetite or significant weight loss, sleep disturbance, for example, insomnia and inability to sleep, fatigue, which is loss of energy, psychomotor agitation, which is excessive movement and thought, or psychomotor retardation, which is slowing of movement and thought, loss of interest in stimulating activities, decreased ability to think and concentrate, feeling that one is of no value to others and that one has done something wrong, recurrent thought of death or suicide. So all of these are symptoms of depression, which is one of the affective disorders, all right? So 5 or possibly 4 of the above symptoms, if 5 or 4 of these symptoms of depression are present in someone or someone suffers from these symptoms, this is called a major depression. This is called a major depression, right? So there is difference between affect and mood. Affect is something that is temporary. Mood is something that is permanent emotion. One of the affective disorders is depression. And these are the symptoms of depression. If someone suffers from 5 of these symptoms, like for example, sleep disturbance, fatigue, loss of interest, suicide, for example, and more psychomotor agitation, for example, this is called major depression. That is dangerous. All right. Neurosis. Neurosis, also called psychoneurosis, is a functional disorder in which feeling of anxiety, obsessional thoughts, compulsive acts, compulsive, we said that it means involuntary, and physical complaints without objective evidence of disease. Neurotic and stress-related disorders. An example of neurotic disorder is obsessive compulsive disorder, OCD. I believe that all of you know what is OCD. Let's here take a word by word in this term. We have obsessive. An obsession is an idea that is so persistent that it interferes with the patient's life. Compulsive. A compulsion is an obsessive idea that forces the patient to act even though they recognize that it's unnecessary. The person does a specific act and they know it's not important, but they have to do it. They feel that they have to do it. A common form of this is compulsive washing of hands. Stress is a feeling of being unable to cope. This is another thing. We have the obsessive compulsive disorder and we have stress. What is stress? Stress is feeling of being unable to cope, unable to continue and carry on. It can lead to anxiety or fear problems. A sudden attack of anxiety is called a panic attack. So what is a panic attack? Is a sudden feeling of anxiety. Other types of functional disorders include behavioral syndromes, which is associated with physiological disturbance, like, for example, eating disorder, like anorexia, the feeling that someone does not want to eat. Disorders of adult personality and behaviors, for example, personality disorder, mental retardation, delayed, which is delayed mental development, and schizophrenia and other disorders in which there are delusions. Delusions mean false beliefs. All right, we have here to complete the table. We have nouns and adjectives. We will get the nouns of these adjectives. Affective. The noun of affective is affect. Anxious is anxiety. Behavioral, behavior. Demented is dementia. Demented means when we say that this person is demented, it means affected with dementia. It means affected with dementia. We have disturbed. The noun of disturbed is disturbance. Suicidal is suicide. Let's move to the next exercise. Make word combination using a word from the box. All right, we have behavioral, eating, measure, mental, personality, psychomotor, sleep, substance, and we have abuse, disturbance, retardation, disorder, depression, and syndrome. We have behavioral syndrome, behavioral syndromes associated with physiological disturbance like eating disorders. So we have behavioral syndrome. And we have the eating disorder, major depression, mental disorder, we have psychomotor, retardation, sleep disturbance, substance abuse. All right, so let's move to the next exercise. Complete the sentence, look at A, C, D, and E opposite to help you. The way a person behaves is his or her behavior. A persistent emotional state is persistent emotional state means an emotional state that is permanent. And we said the permanent emotional state is mood. A sudden attack of anxiety is a panic attack. The form of dementia associated with aging is called senile dementia. A disorder which is not associated with pathological changes is functional. An idea which forces a patient to repeat unnecessary action is a compulsion. And this disorder is OCD. Which symptoms of depression was this patient suffering from? Let's read it together. A 56-year-old woman presented to her general practitioner complaining of increasing tiredness over the past few months. So here the first symptom is increasing tiredness, which is fatigue. She had lost interest in most things. So this is another symptom, loss of interest. She was sleeping poorly and tended to wake up early, but denied any suicidal tendencies. So, sleeping poorly, this is what insomnia or sleep disturbance. She was thirsty and was passing urine more often. She was eating normally and her weight was steady. So these are the uh, symptoms of depression that she has. Let's move to the next topic, which is medical ethics. Ethics is a system of moral principles. The principles dealing with what is good and bad, and with moral duty and obligations, what we have to do and what we should not do. In Arabic, medical ethics is like adab al-mihna and morality, things that are related to al-qiyam, all right? So when you have, when you do anything that you have to think before and you have to see that if this is ethically accepted or not, all right? We have here the GMC guideline. GMC is an abbreviation of the General Medical Council. General Medical Council. If you remember, we said that registered doctor, they have to be added to the General Medical Council. It's a public body that maintains the official register of medical practitioner within the United Kingdom. They added some of the guidelines that practitioners, medical practitioners, have to follow. Like what? The duties of a doctor registered with the General Medical Council include: make the care of your patient your first concern. Care here means protecting and looking after someone. Treat every patient politely and considerately. Give patients information in a way they can understand. Keep your professional knowledge and skills up to date. Recognize the limits of your professional competence, which is level of specialized knowledge and skills. Be honest and trustworthy. Respect and protect confidential information. Confidential means private and secret. Make sure that your personal beliefs do not prejudice your patient's care. Prejudice means have negative influence on. That you don't have a specific belief, religious belief, for example, that can affect the judgment on a patient. Number 9, act quickly to protect the patient from risk if you have good reason to believe that you or your colleague may not be fit to practice. What is the meaning of fit to practice? In a suitable condition to work. These are the General Medical Council guidelines. We have bioethical issues. What is the meaning of bioethical? What is bioethics? Bioethics is a term that consists of bio, like biology, and ethics. So, bioethics is a field of study concerned with the ethics and philosophical implications of certain biological and medical procedures, technologies, and treatment. So, it's the ethics that are related to the medical procedures, operations, treatment, all right? Like what? Like, for example, organ transplant, genetic engineering, and care of the terminally ill, all right? What is the meaning of terminal illness? A terminal illness is a disease or a condition which cannot be cured and is likely to lead to someone's death. It's sometimes called a life-limiting illness, all right? So terminal illnesses are illnesses that cannot be cured and that the patient is most probably will die. Some of the topics of bio ethics is euthanasia. What is euthanasia? Should the medical profession help the terminally ill to end their lives when they choose? So, euthanasia is to give the patient the choice to end their life when they know that they have uh, a disease that is incurable, that cannot be cured. They have the choice to uh, end their lives. This is euthanasia. Genetic engineering. Should we permit, allow an embryo to be cloned, copied exactly to replace a child who has died? Should parents be able to select the genetic makeup of their children to produce so-called designer babies? Human fertility, which is abbreviated in vitro fertilization, which is abbreviated as IVF, in vitro fertilization. What is the meaning of in vitro? In vitro means outside the living body in an artificial environment. So in vitro fertilization means fertilization of an egg in a laboratory dish or test tube. In vitro fertilization has made it possible for infertile women to have children. But should this include women long past the normal age of childbearing? Embryos can be frozen and implanted in the mother of a later date, but should this require the consent, the acceptance, or permission of both parents if the marriage has broken down? What are the rights of a surrogate mother? Surrogate mother is a woman who becomes pregnant by artificial insemination or by implantation of a fertilized egg created by in vitro fertilization for purpose of carrying the fetus to term for another person or to term for another person, right? So she carries the fertilized egg. One who carries a child for a woman who is unable to do so over the child. Transplant surgery. Who should give consent for removal of body parts for transplant surgery? All of these informations are bioethical issues. Assisted dying. A medical student has made some language notes on journal article. We have a 53-year-old woman with incurable cannot be cured, cannot be treated, with incurable muscular dystrophy. What is the meaning of dystrophy? Muscular dystrophy is any of a group of hereditary diseases characterized by progressive wasting of muscles. Flew to Switzerland to end her life. She has this disease, muscular dystrophy, and she knows that it cannot be cured, and her muscles are in continuously are wasting. All right, she knows that she will be dead, so she decided to travel to Switzerland in order to end her life. Assisted dying is legal in Switzerland, but illegal in the UK. Opponent of euthanasia, which is, as we said, that the patient decides to end their life. Opponent of euthanasia, which is also known as mercy killing, argue that legalization would lead to abuse and call for doctors who participate to be struck off. They are afraid that doctors may decide to end the life of the patient while there may be a possibility that this patient can be cured, for example, or they want to have another chance or anything like that. So if this happened, that the doctor decide to end the life of a patient while for example, the family of this patient do not want him to do this, what will happen? The doctor will be struck off. What is the meaning of struck off? It means to be removed from the General Medical Council register and banned from practicing medicine in the UK. What Britain needs, they claim, is better palliative care. What is the meaning of palliative care? It means treatment to relieve rather than cure symptoms. Treatment to relieve. And more, hospice is for terminally ill. What is the meaning of hospice? Facility providing care for terminally ill patients. So instead of ending their life, there should be more care for those who are terminally ill, that they should provide them with more care. As we said, terminally ill, not expected to live, to allow such patients to die with dignity. This follows a recent US case where the husband of a woman who had been in a persistent vegetative state, which means unable to speak. This woman was unable to speak or follow simple commands. She does not respond. She does not respond in any physiologically meaningful way for 16 years. The husband was successful in having artificial feeding withdrawn in spite of opposition of his wife's parents. So her parent wants her to be to live. She will not interact with them, but they want her to be alive, to be kept on the artificial feeding. But the husband succeeded in having this artificial feeding withdrawn. So here, assisted dying means what mainly? It means to provide care and welfare to those who will eventually die for the terminally ill. Instead of killing them, providing them with luxurious life. Let's move to this exercise. Which of the General Medical Council guidelines is in A opposite is breached in each of these cases? Let's have an example. A general practitioner falls asleep regularly during consultation. His colleagues do nothing. This refers to this point. Act quickly to protect patient from risk if you have good reason to believe that you or your colleague may not be fit to practice. So his colleagues should do something in order to protect the patient. A doctor is aware that a patient has a history of violence against women. She informs a friend whose daughter had just become engaged to this man. This is, of course, a violation of number 7, respect and protect confidential information. Number C, a doctor attempts to dissuade a patient from having an abortion as this procedure is against his religious beliefs. This is according to the GMC against number 8. Make sure that your personal beliefs do not prejudice your patient's care. A doctor refers a patient to a medical textbook for an explanation of his pancreatic cancer. Instead of explaining to the patient, he gave him a book in order to understand his disease, the disease he suffers from. This is violation of number 3. Give patients information in a way they can understand. A doctor fails to complete the number of days of professional development training advised annually. This is a violation of number 4. Keep your professional knowledge and skills up to date. A doctor tells a seriously overweight patient who has ignored his advice to diet that she deserves any ill effects that might result from her obesity. This is a violation of number 2. Treat every patient politely and considerately. All right, let's move to this exercise. Match each headline to an opening line from a newspaper report. 66-year-old woman year-old become oldest mother. Frozen embryo case to go to Europe. Surrogate mother sued by couple. Embryo cloning, where will it take us? Using body parts without consent. UK full face transplant surgeon. Designer baby, rules are relaxed. Rules are relaxed. Doctors back infant mercy killing. Back here means support. Number E. A woman of 30 who agreed to bear a child for a childless couple, then refused to part with the child. She refused to give them the child. This is number 3. Surrogate mother sued by couple. Number B. A surgeon has been accused of removing organs from patient without their knowledge. This will be number 5, using body parts without consent. 3/4 of Belgian doctors are willing to assist in the death of critically ill babies to end their suffering. This is number 8, doctors back infant mercy killing. A woman hoping to stop the destruction of 6 embryos created with her eggs and her ex-partner's sperm launched a case at the European Court of Human Rights. This is number 2, frozen embryo case to go to Europe. A woman has given birth in Romania following in vitro fertilization treatment. This is number 1, 66-year-old becomes oldest mother. Consultant plastic surgeon Dr. Peter Butler has been given the go-ahead by Hospital Ethics Committee to find a patient who meets selection criteria for a full face transplant. This is number 6, UK full face transplant surgeon. Number G, if your favorite pet dies, it's technically possible to produce exact replicas. But what about humans? This is number 4, embryo cloning, where will it take us? Number H, it's now legal to select embryos to provide blood cell transplant for sex sibling. This is number 7, designer baby, rules are relaxed. That the relaxed means here are not strict. Let's move to the third topic, which is research articles. Whenever you have any topic that you want to know more information about, you should read medical articles. So these articles have, most of them, they have a specific structure. This structure is called Emerald model. What is the Emerald model? I here stands for introduction, M for methods, R for results, and D for discussion. This is the structure of the medical paper. So if you read any paper now, you can find these sections. What is the introduction? The introduction starts with a broader topic, general background, and narrows down to the thesis statement. All right? In the thesis statement, the writer, the researcher, says what is this article is about in a very concise sentence. Method. The method provides scientific details, evidence, and arguments. Results states findings. Discussion provides interpretation, gets broader, explains significance for field and gives recommendations. So here the structure of a research article. As we said, we have introduction, method, results, and discussion, which is called the emerald structure. The introduction contains background information. In other words, it reminds the reader what is already known about the subject. It includes information about previous studies and explain what has been investigated previously. Finally, there is usually a statement of the objective. What is the meaning of objective? Objective means purpose of the research. الهدف. In case of clinical research, the method section gives details of the people who were studied, the participant in the research. All right, so the method gives details about the participant in a specific clinical study. The method section also contains information about any intervention carried out. For example, medication, advice, operation, all of these are added in the method section. It gives details of the steps taken in the study, how the participants were chosen, and includes the main things measured, such as blood levels. Finally, there is information about statistical analysis. The results section tells us what was found, the findings of the study. The discussion section contains explanations and claims for the importance of the study. It may also list limitations or parts of the study which were unsatisfactory and suggest what research needs to be done in the future. So what is the meaning of limitations? Limitation is in this part. The researcher says what is the parts that the next researchers should study and examine, where his research stops, all right? There is usually a conclusion, which is sometimes a separate section. At the end of most articles, there is a short section called acknowledgement. In this, the author thanks people who have helped them in their research, all right? So, as we said, we have the introduction, the background, And at the last sentence, there is the objective, the purpose of the research. We have method. In the method, we say if there is a participant in this clinical research, what are the medication, the advice, the operation that happened during this research, and they say any statistical analysis. In the results, the researcher says what are the findings of this research. In the discussions, it contains explanations and the limitation of the research, and for the conclusion, it can be in the discussion or it can be a separate section. And there is an acknowledgement where the researcher thanks anyone who helped them. In the objective, statements about objectives often contain the following verbs. In the objective section, the researcher, for example, say the verb assess, which means evaluate. This is a synonym for evaluate, assess and evaluate. Determine, investigate. So we have, for example, we assessed whether. The aim of our study was to determine whether. We investigated the. This study evaluated the. All right. These sentences are commonly written in the objective section. Main findings. The discussion section usually begins with a summary of the main findings. This is related to the objective of the study, like, for example, show, confirm, provide evidence. So, for example, they say, we have shown that, our study confirmed that. These findings provide strong evidence that. If the results are less certain, they say suggest. So if the results of this research are not sure, they are not certain, they say suggest. These results suggest that. And with negative results, they say, sorry, they say fail to, like this study failed to show that. Let's see this exercise. Read the 8 extracts from an article in the British Medical Journal entitled Parental Age and Schizophrenia, a population-based cohort study. We will read these extracts and we will say it's in the introduction or in the discussion or methods or anything of these sections. Number 1, people with older fathers were more likely to lose their parents before they reached the age of 18 years. This is in the section of results. Number 2, using a large Swedish record linkage database, we investigated the association between parental age and schizophrenia in offspring. This is in the introduction. Our cohort comprised this number of people born in Sweden between 1973 and 1980. This is, of course, a statistical analysis, which in the method section. Sorry, in the method section. Our offspring confirm an association between increased parental age and schizophrenia in offspring, which remained even after we controlled for a wide range of potential confounding factors. This is one of the main findings. So this is in the discussion, or it can be in the finding. In the results. There is growing evidence that factors operating at different points in life contribute to an individual risk of developing schizophrenia. This is in the introduction. The main limitation of the analysis is whatever. So from the beginning of the sentence, this is in the limitation section, which is in the discussion part. Table 1 shows the characteristics of the subject in relation to the age and their fathers. This is in the results. All right, now let's move to the abbreviation part. Here we have abbreviations that you have to know because they are very common. We have A&E, accidental and emergency. AIDS, acquired immunodeficiency syndrome. BMR, basal metabolic rate. Computerized axial tomography. Coronary heart disease. Diarrhea and vomiting. Dead on arrival. General practitioner. Hepatitis A virus. Human immunodeficiency virus. Motor neuron disease. Over the counter, as in over the counter remedies. Post mortem, after death. Progressive muscular atrophy. Premenstrual tension. Respiratory quotient. Repetitive strain injury. Seasonal affective disorder. Sudden infant death syndrome. Sexually transmitted infection. Tuberculosis. Total body irradiation. Ultraviolet. Valvular disease of heart. World Health Organization. So this is for our lecture today. Goodbye.